one side, two.
Hi, I'm Yan Cheng, Senior Pharmacist at Watson's Personal Care Stores. I've been a pharmacist for 5 years. I currently am based at a store in the Heartlands where I get to interact with Singaporeans from all walks of life. In serving my patients, I listen to them actively and provide advice on use of medications, supplements, and health monitoring devices. As a mentor, I also do my part to guide future pharmacists in the store to teach them how to provide effective patient care under a controlled environment. As Watsons is a champion of health and wellness, we also look towards the future and prepare for the aging population. Watsons sends us for courses on geriatric care, and we actually serve nursing homes to help optimize the medications of residents. I'm also with the Pharmaceutical Society of Singapore. We have produced some initiatives such as antibiotic guidelines as well as medication management. So during the COVID pandemic, our role towards public health is to help reduce the spread of the disease. So this was through a few measures. Firstly, we will be referral points for patients presenting with cough, cold, or other symptoms of acute respiratory infection. This would help direct patients to the public health planners clinics. We also would provide advice on sanitizers, disinfectants, as well as COVID antigen rapid testing. So all these measures are to build up our country's response to stem future spread of disease. During the COVID pandemic, there were also cases where patients who got the medications from overseas previously, but they needed alternatives. So as a drug information resource, we will help propose alternatives to the prescribers. We also play the role in coping with the changes from COVID-19 prevention measures. This would include mental health wellness such as sleep hygiene, exercise, and for those who had skin irritation from overuse of sanitizers, we will counsel them on moisturizer use and milder cleansers that will be more compatible with the skin. To support the COVID preparedness initiatives from the Pharmacist Foundation, we help guide Singaporeans in the use of vitamin D, oximeters, and COVID ARTs. So traditionally, pharmacists from the dispensary will be limited to medication counselling, dispensing minor ailments. Moving forward, we will aim for higher quality services that have a better impact on patients' health. This is achieved through a few means. Firstly, chronic disease management. We have pharmacist-led services such as diabetes care, where patients who feel that they need more help in understanding a diabetes condition and medications get advice from the pharmacist. So the pharmacist may help to review the medications, review their blood sugar, and help them find a solution. For smoking cessation services, we help to educate patients on the long-term effects of tobacco, guide them through the process of nicotine replacement, as well as to provide motivational interviewing to find out what are the ways that we can give them ideas on how to proceed on their quit smoking journey. Pharmacists will also be deployed to senior activity centres to provide pharmaceutical care services. So this would be patients who have trouble managing their medications or patients with complex medication needs. So pharmacists will help work with the patients, their caregivers, or centre-based staff to find out if there are means to optimize the medications, explore lifestyle changes so as to improve patient-centered outcomes. So moving forward from the pandemic, we've actually learned some lessons that would be useful to improve the healthcare experience. The rapid uptake of technology is an enabler for pharmacists to provide convenient healthcare to patients. So with teleconsultations and medication delivery, healthcare can be a more seamless process, and this can help to improve health outcomes. So pharmacists will be moving towards a more patient-centered care model, where the beliefs and preferences of patients are taken into account before we propose any medication-related interventions. This would help the patient have a more positive healthcare experience and have more sustainable health-promoting habits. The one thing I'd like to share is that the person with the biggest power over your health is yourself. So as healthcare professionals, what we do is to provide you with options and information so you can make the most informed choice that you feel is best for yourself. If you have any questions, just ask your pharmacist.